War. What is it good for? Advances in medicine, war has and still continues to be a huge factor in shaping the medical field that has been developed today. Without the foundation of new diseases and injuries, the healthcare system would be much different. From the Civil War to present day conflict in Iraq, advances in medicine are still being made. The Civil War is known as one of the most deadliest and bloodiest wars ever fought. This is a battle between the northern and southern states, also known as the Union and Confederates. This war began mainly due to the inability to compromise about which states were free and which states had slaves. Typically, the northern states wanted to abolish slavery, and the southern states were very against the idea of abolition. In the end, nearly 625,000 people died. This is a staggering number of people considering it was Americans fighting fellow Americans. Surgeons of this era did not have much knowledge about the importance of the surgeries that were being performed. They were not concerned so much about the accuracy of the surgery, but how fast it was done. Amputations were a big part of the Civil War. The average leg amputation from start to finish lasted about 12 minutes, as it was very fast-paced and performed numerous times daily. Surgeons of the Civil War turned very complex surgeries into easy ones in a matter of minutes. Another medical advancement that was made were facial reconstruction surgeries. During the Civil War, 32 plastic surgeries on disfigured soldiers were successfully completed. Gurdon Buck was the surgeon behind most of the surgeries performed, and he realized a way to use sutures that led to minimal scarring. This is something that is still practiced today. Patients that undergo plastic surgeries expect the results to look seamless and natural to other people, so utilizing this method makes that possible. The Civil War made many important medical advancements, and without the knowledge that has been gained, the medical field would not look the way it does today. In World War I, America took Germany to war because of the sinking of the Lusitania. There were thousands dying from loss of blood due to their wounds. This led to thousands of deaths without a solution. Medical professionals needed to find a way for patients to stop losing blood. Once the United States entered the war in 1917, doctors like Roger Lee and Hope Robertson helped to influence blood transfusions and how to store blood awaiting for transfer. Initially, Robertson used blood drawn into 1-liter glass bottles, converting ammunition boxes into shipping containers, with sawdust and ice packed around the bottles. Being able to store blood in advance is a great way to be able to have blood available right when the doctor may need it. The ability of blood transfusion development has influenced today's world as well, with many blood banks and blood transfusions done daily to help prevent patients' death from loss of blood and to give them a second chance at life. New extreme and deadly weapons were introduced in World War I, like mustard gas, flamethrowers, and different explosives. These new weapons caused many different types of wounds in which many doctors could not figure out how to fix. This caused many innovations in medicine to be able to fix these new wounds. Many of these new wounds resulted in procedures like severe facial disfiguration surgery. Due to explosions from the new weapons, many of the blasts resulted in severe burns and in extreme cases, taking all the skin off of a certain area. This trauma led to new, innovative surgeries introduced by Dr. Harold Gillies, like repairing faces, grafting skin and tissue, and the pedicle tube graft to provide blood flow to the reconstructed area, which is still used today. It wasn't perfect by any means, but it was a means to disguise the disfiguring injuries so they could have a semblance of a normal life. Sometimes for these procedures, the doctors were unable to do skin grafts and had to perform face prosthetics, which include artificial eyes and skin used from other parts of the body. While the Civil War utilized facial reconstruction surgeries, World War I improved the surgeries and nearly perfected them. These were just many ways in which World War I has affected medicine and how they are still used today. World War II was fought between two sides, called the Axis powers and the Allies. This war began with the Holocaust, when Adolf Hitler led Germany to start a genocide where millions of Jewish people were murdered. This is what led to the next war being started. During this war is when penicillin began to be utilized heavily because they needed fast and effective medicine on the battlefield. Scottish bacteriologists discovered penicillin by accident in 1928 while conducting research using several petri dishes of bacteria cultures. One of the Scottish bacteriologists accidentally left one of the cultures uncovered for several days. This is how penicillin came to be. In World War II, it was the first war to utilize it because without it, the use of penicillin there would have been many more casualties. During World War II, pain seemed to be a main theme around the world. Yet at the same time, everyone wanted the pain to end, and so painkillers were invented to help reduce pain. At the time painkillers were first introduced, they were mainly used for wounds which were bleeding out or after a patient has just undergone surgery. A painkiller in which was discovered is morphine. At the time, a pharmaceutical company said the only way to administer morphine is in a squirt-able tube like toothpaste. Morphine was a great tool for wounded soldiers and an aid to help them get back to battle and help their bodies regenerate faster. With the influence of morphine at the time, it was also aided to develop codeine, methadone, and different opiums. Without this medical advancement of the war, the world would not have medicines and painkillers for daily surgeries and major surgeries done every day. In the Korean War, medicine changed worldwide. It all started because of the invasion of what is called North Korea into South Korea. North Korea crossed the 38th parallel, and this is when war was declared. Harry S. Truman was the President of the United States at the time. In 1950, he sent help to South Korea so they would not lose the war. During the Korean War, helicopters were used for faster transportation to receive medical help. These aircrafts made it more effective for the wounded soldiers. America's use of helicopters in the Korean War spawned the use of helicopters for uses in today's world for transporting very injured civilians in everyday life. The war became more horrific to watch, and many doctors and nurses were going to Okinawa to treat the people. Head wounds were very common to Americans and Asians, even infants were affected by these. Amanda, who was a nurse heading out for battle, didn't know what she was getting herself into. The doctors and nurses were ready to take off, but then she said we couldn't get in. We had to back out because the tide was going back out. They waited, and when they got there, they were in big trouble. Many were hurt. When they arrived there, they were immediately told to go to the ones who were hurt the most. Many were left dead. Many didn't want a woman to see them at their lowest point. The year 1954 marked the start of the Vietnam War. The United States of America got involved when the French came asking for aid. There were many people getting hurt and injured. This war used a gas called Agent Orange. It was a pesticide sprayed by the United States during the Vietnam War. Many children were born with a cleft palate, heart disease, mental illness, or other diseases. The United States had made the Agent Orange to clear a path. It was like killing two birds with one stone, so they could see the enemy through trees. The consequence to making this gas was that the men who created it had gotten sick. They now live with leukemia, Hodgkin's disease, or Parkinson's disease. The men who created it most likely passed it down to their children, which will have a long-term effect. As the war went on, there was an invention called the artificial kidney, which in today's world people would call it dialysis. Dialysis is where the waste products from the blood are removed artificially. Mr. Nonandio, who had just been drafted to the Vietnam War, had been sent to the 3rd Field Hospital. He and Captain Andrew Welton, MD, shared medical responsibilities. For 1 year, Mr. Nonandio and Captain Andrew were the first to run a renal unit. The mortality rate was 70% and was observed in patients sustaining post-traumatic combat during the 6 years. He said that this was something that he had learned and relearned from World War II and after that. At this point, many could see the multiple side effects from the war, especially from the gas called Agent Orange. The Iraq War began when armed forces were in Iraq from the United States. The war escalated quickly after 9/11 and terror attacks. What is not commonly discussed about the Iraq War are the benefits. An unforeseen benefit of the Iraq War is the ability to pick up new technology and innovative new medical advances from the battlefield and use them in some third world countries for daily use. The key to saving a wounded soldier from the battlefield is keeping them from bleeding out on the way to the hospital. Epidemiologist Richard Sullivan has helped to apply the use of hemostatic powders. This is a powder that stops bleeding when poured directly on an open wound. This product can help drastically in third world countries because it's a fast fix at a little cost. Iraq may have had a lot of casualties like many wars, but it did help to advance the way third world countries are able to conduct medical care with ease in a crisis. War has been a monumental effect on society in the way it changes the environment once it is over. Just like it was discussed, war has changed many things, especially in medicine and the way people look at the world today. Throughout history, wars have helped advance modern technologies in the medical field, like how the Civil War had one of the first amputations, which has been modernized and is still used today. Or like World War I and II, many medical advancements were introduced like blood banks and painkillers, as well as an advancement in the ambulance system during the Korean War, and the cure for cleft palate and some heart diseases in the Vietnam War. We're now in current times where war is still influencing medicine with hemostatic powder in Iraq to stop bleeding. These are just few of many ways in which medicine has affected wars and the world afterwards.